Okay, so hello and welcome to the criminal legal system as a social determinant of addiction. This is the fourth webinar in a series from the American Institute for Research, Center for Addiction Research and Effective Solutions webinar series. Today's webinar will focus on effective drug policy, highlighting the collateral consequences of punitive criminal legal approaches for people who use drugs, as well as discuss strategies to assist those returning home to their communities from prison and jail, as well as highlighting the approach that one state, California, is taking to reverse the harms of the war on drugs and restore communities. Today's webinar is part of a larger series on the social determinants of addiction, the 4 Ps: people, policy, programs, and practice. And we'll be featuring experts in the addiction field and focusing on the specific social determinants of health, in this case, incarceration or criminal legal system involvement, and their relationship to substance use disorder as well as overdose. So each year, more than 600,000 people are released from federal and state prison, according to recent numbers released by the federal government, and more than 9 million cycle in and out of jail. We know that while somebody is incarcerated, tolerance is reduced, and upon release, people who use drugs are at significantly higher risk of overdose. This is due to a number of factors by which incarceration destabilizes people socially and economically. They leave prison and return home with reduced social support and are often disqualified from many forms of housing and employment, with minimal or no access sometimes to treatment for substance use disorder, both while they're incarcerated and difficulty making connections when they return home. I am so thrilled to have an amazing panelist on the webinar today. Our moderator will be Dr. Amanda Lattimore at American Institute for Research, the director of the Center for Addiction Research and Effective Solutions. We also have Mr. Scott Burris from Temple University, Mr. Antoine Quarles from the executive director of Helping Oppressed People Excel, or HOPE, in Baltimore, Maryland, and Mr. Alejandro Rayagosa, who is coming to us as a grant specialist and program lead with the California Governor's Office of Business and Economic Development. I do want to make a quick note that the chat is off, but Q&A box is open, so please, we will have an opportunity for questions and answers, so feel free to input any questions that you might have there. And with that, I will turn it over to Dr. Lattimore, and are thrilled today to kind of talk through kind of how we got where we are, what some of the evidence is that exists for punitive versus supportive policies, highlighting what works for people who use drugs as well as those in recovery, and what states can really do to reverse some of the significant harms that have been caused by the drug war.
Thank you, Kelly. So I'm very excited to have the panel that we have, and my goal right now is just to set the stage on set the stage for the panelists to talk a little bit about the background on the criminal legal system as a social determinant of addiction. So the war on drugs has really been a war on drugs that have been singled out at one point or another in the 50-year history of the war on drugs. And as you can see, when this war was waged over half a century ago, it is, from that point, it's gone through many different phases where the focus, the public enemy was marijuana or crack, then prescription drugs. And the US response to drugs can be characterized across time by militarization, harsh penalties, fear-based initiatives, prohibition-based responses. So prohibition makes all of this possible. And the huge increases in spending on drug policy You can see at the bottom there the increase from 1.5 billion to 9.8 billion to what is now 40 billion. These increases have been followed with increases in deaths. And just this past year, we saw 107,000 overdose deaths. So with that increased spending has come, increased militarization across time to catch the kingpins. That was the justification. Increased arrests, but notice that the increases are more for possession than for selling. Again, all the while drug death is increasing. Reducing the supply of illicit drugs involves domestic law enforcement, interdiction, and resources for the international work. And addressing the demand for illicit drugs involves treatment and prevention programs. And up until the Obama administration, drug policy really, the funding for supply side intervention was substantially higher than for treatment and prevention. And it peaked in 2010 when the criminal legal approaches were more than 70% higher than that of the supportive resources. And this is around the same time that we had the Fair Sentencing Act passed. Also at the same time that there was a huge ramp up of public awareness about prescription opioids, and prescription monitoring programs became more popular, which put a lot of strain on the patient-prescriber relationship and made it more difficult for people with chronic pain to access the medication that they needed, and pushed them towards the underground market to address their pain. So this is the balancing act of policy. While the pendulum swings, in one area towards supporting people, it may be swinging in another area that threatens to diminish the positive impact of that support. And what is the link between prohibition-based policy, supply-side investments, and the unrelenting rise in overdose deaths that we're seeing? First and foremost, we've got the iron law of prohibition. As you drive the sale of drugs underground, that creates a market that is unpredictable, inconsistent. The products become more and more toxic. To make it economically viable, there's lots of money to be had, and so any changes in policy can, as long as that market's still there, can really drive violence. It drives stigma. How? Well, that's by making drugs illegal. The use of a drug, which is illegal, is a crime, and people who use said prohibited substances are, logically, if you follow that logic, they're criminals. So looking at people as criminals means that we are distancing ourselves from them, and by definition, they're violating the rules of society. And so we've used, people use that to distance themselves and create these us versus them narratives for people who use drugs. This makes it easier to discriminate, disenfranchise, demoralize. And this leads me to the next point, which is because drug policy across decades has been, at the very least, racialized, and you could go all the way to drug policy has been racially motivated. This stigma interacts with racism. And so whether it was the cocaine craze, that's a real quote from history that motivated the nation's first drug laws in 1914, or you're talking about crack babies of the 90s that coincided with one of the largest increases in police militarization. Our leaders have time and time again called on racial tropes and stereotypes to stoke fear in voters and to do all of that to gain political momentum. The us versus them allows people of color to make up 75% of the prison population, even though they only make up 1/3 of the population in the US and are no more likely to use or sell illicit drugs. The us versus them narrative allows people of color to be stopped, frisked, interrogated, shot, and experience police-induced homicide at 3 times the rate of white people, even though the data suggests that Black people are less likely than white people to be carrying contraband among those that are stopped. And regardless of the motivation, whether it's intended or unintended, The consequences for Black families, Black communities has been great. But make no mistake that these punitive policies affect everyone. And here's the shift that we're seeing now. When enough people from the dominant group are affected, the cognitive dissonance becomes too great. It's hard to maintain this us versus them narrative and maintain that stigmatization when the them looks too much like me. And so now many are advocating for softer responses to drug policy. And hey, we'll take it, because prohibition-based drug policy also creates fear that limits people accessing services. It rushes injections among those who inject drugs. It isolates folks. It increases infectious disease, increases excess incarceration, which leads to overdose, higher rates of overdose post-release. There's a lack of evidence that punitive drug policies decrease problematic use. And Scott Burris is going to talk a little bit more about that later. So there are a number of barriers to policies that are intended to impact health, to reduce overdose deaths, to reduce problematic drug use. And so, looking at the full range of options: legalization, decriminalization, reduced police contact, pre-booking diversion. Those are the more evidence-based approaches to alternatives to criminalization. But you've also got, protection from drug charges, services for those who are incarcerated, and, at the very bottom here, maintaining the status quo, which is obviously not working for the country. But regardless of which one of these options that you choose, there are barriers, like how you regulate the drugs. If there's sufficient funding for support services, are you actually reversing the harms that were caused by the drug war? There's a net widening sometimes where, even though drugs may be legal, there are increased use of citations. And there are myriad ways in which, some alternatives for criminalization actually reinforce criminalization and the punitive system. And so I will just conclude with this quote from the Lancet Commission, and they offer a number of different recommendations for the future of drug policy. I know that our panelists are going to cover some of this, so I'll leave you all with this quote, which is, "At a time when drug policy discussions are opening up around the world, there is an urgent need to bring the best of the non-ideologically driven health science, social science, and policy analysis to the study of drugs and the potential for policy reform." So with that, I'm going to ask Scott Burris to turn his video on. And I will just say that Scott Burris is a professor of law and public health at Temple University, where he directs the Center for Public Health Law Research. He's also a professor at the College of Public Health. His work focuses on how law influences public health and what interventions can make laws and law enforcement practices healthier in their effects. He is the author of over 200 books, chapters, articles, and reports on issues including urban health, HIV/AIDS, research ethics, and the health effects of criminal law. In 2014, he was the recipient of the American Public Health Association Law Section Lifetime Achievement Award. And we're very pleased to have you. Please take it away.
Well, thank you very much. And I will be picking up, as Amanda says, pretty much where she left off, and in fact, maybe doubling back on a couple of points. I mean, I'm absolutely committed in my career and in my work to the idea that evidence should guide policy, that a society that's moving forward blindly implementing policies that are supposed to have an effect without knowing whether they have that effect or whether they have side effects is a society that in the long run is not going to succeed in dealing with the challenges that it's trying to deal with. That said, we have to acknowledge, in fact, our starting point is that drug policy is one of the many areas of law that are drastically understudied. So a careful scientist like Amanda is going to be cautious in talking about the causal effects of our drug policy. But I think this is one of those situations where the epidemiology itself tells us what's going on. We're just looking at the descriptive statistics, tells us what's happening and what's not happening in terms of the stigma, in terms of the lack of impact of drug policy, in terms of the harms that drug policies can do. So I'll be taking kind of that broad view. My starting point is to understand that drug policies, laws generally, are part of the picture of the deep drivers of health. So we talk about the social determinants of health, and conventionally we understand that things like access to education or intergenerational wealth, to economic opportunity, to a safe, healthy home, all those resource questions essentially provide the starting point in people's lives. Even before they're born, they're being affected by their environment. And then as they go through life, and they go through various kinds of activities and systems, the effect of having a positive education versus a negative education, a safe house versus an unsafe house, an interesting and rewarding employment versus stressful or harmful employment, all of those gradually help change that starting point into a health outcome. And what we understand very well is that people who have a rougher time, who start in a worse place or a less advantageous place and then go through a tougher life, end up dying sooner than people who start in a more comfortable place and have it easier going through their whole life. Now, the important thing to understand is that this story is also a legal story. So when we talk about starting points for people's lives, their zip code, their economic position, their social position, those are to a considerable extent shaped by law. And in particular, when we're talking about an important concept, we're talking about inequality and an important concept like, say, structural racism, we understand that over 40 years, 50 years almost, federal, state, and local policy made it pretty much impossible for black people to build the same kind of intergenerational wealth in their houses that white people were able to build, particularly in the 50s and 60s. If you were a black veteran after World War II, as Richard Rosenberg has shown in his book, The Color of Law, very powerfully, you couldn't buy a house in Levittown. You had to buy somewhere else. And therefore, unlike the people in Levittown, you might have had over 50 years between you and your children, your $50,000 or $10,000 home might have increased in value to $100,000. But a home in Levittown that a white person was able to buy and a black person wasn't increased from $10,000 at a subsidized price to start with to well over $1 million. That's exactly the way that laws like redlining laws and laws that protect or don't protect against discrimination set people up into a position that they're going to move through for their whole life. But as they move, they interact with law. Laws, after all, tell us what our employment rights are. They create greater or lesser support for unionization of workers' rights. They help us maintain our housing or let it decay. They influence whether housing is fair or not. Education law, drug use is the big one of this one, right? Some of us, from a more advantageous starting position, may get caught using drugs and go to a treatment court and be discharged. Others are going to get a criminal record and start going to jail. And as we know, those patterns are not random. Your starting position, your race, your social position affects whether your drug use arrest is going to be the beginning of a slide to prison or a momentary interruption on your way to prosperity. Now, as Amanda has said, criminalization of drug use has so many well-known drawbacks. To start with, the process of locking black people up for for violating drug laws is directly linked and continuous with earlier practices that locked people up for vagrancy, that led to essentially the reimposition of slavery after the Civil War, when people were arrested simply for existing and then put to work in conditions that were much like slavery. the war on drugs is built on all these inaccurate beliefs and often very cruel stigmas about drugs and drug dependency. We exaggerate the harms of illegal drugs, while we often tend to tolerate many of the harms, or at least to accept the harms of legal drugs. In so doing, we let the social factors off the hook. It's not just the drug, it's who's using the drug, in what environment, for what reason, with what resources, as they use the drug for treatment or for other diversions. And of course, it also helps perpetuate myths about treatment and recovery, with the idea that you have to hit rock bottom, that recovery is about abstinence and only abstinence. And these are all myths. And ultimately, what criminal law has done, and this is pretty demonstrable, and Amanda has gone over some of that evidence, that we actually create more harm through criminalization than we prevent. I mean, I'm a public health person, so I acknowledge and am concerned about the harms that all drugs can cause. But I want my solution to be something that reduces the overall harm, not something that actually adds to the harm. And criminal law is pretty demonstrably added to the harm of drugs. And most importantly, the bottom line is, it has never succeeded in reducing either supply or demand for drugs. Basically, heroin has been cheaper and purer every day since the Controlled Substances Act was enacted, and we can see that. The amazing thing is that people can still look at a drug problem in their town or in their state and say, hey, what we need is more prisons and more cops. We have been going to that playbook for 50 years or longer, and it's never worked. How many times do we bat our heads against that wall? Meanwhile, we have considerable evidence that supportive approaches work better. And supportive approaches start with some more realistic assumptions or more realistic truths, right? I mean, drugs cause harm for many people who use them, although by no means all. So right off the bat, just because you're using heroin doesn't mean you have a heroin problem. Just because you use cocaine doesn't mean that you're going to have a substance use disorder. Some drugs, in fact, most drugs, provide some benefits to the people who use them, even if they're benefits that you might say come from having very few options for benefit. They're still providing benefits. So if we got to start in a much more pleasant position, I think. For me, it's more pleasant. Rather than starting with blame and stigma, we can start supportive approaches by valuing the lives and the well-being of everyone who uses drugs. They're not the other, they're not separate. They may be annoying sometimes, and they may do bad. Some of them may do some bad things, but these are still citizens, human beings, people that we love. Harm reduction and social services can meet their immediate needs, but we can't settle for that, because that's very proximate to the end point of their problematic drug use. It's very late in the chain of causes. We can go back a little bit and say, well, for the whole life, new drug users, old drug users, people who are just starting, people who want to quit, have to have access to treatment for their whole life, and at any time in the life course when they need it. But ultimately, we have to get back to the question of the comparative pleasures available from drugs and other aspects of life. Equitable societies provide people with a range of things they can do for pleasure and satisfaction. Inequitable societies tend to squeeze those elements out of life, leaving only things like drugs to treat the ennui, the pain, the stress. We talk about having deaths of despair. That's not because people just are in a bad mood. They are living in a society that is inducing despair. And therefore, you have to think about what the society needs to do to create lives of meaning, to change an environment where drugs just aren't going to be that necessary for those who find them necessary, and won't be that appealing to people who perhaps could find pleasure in other things. From a public health point of view, I'd love to see fewer people using fewer drugs less often, because that's healthier. But I'm not going to see that if life is driving people towards dangerous behavior. Now, finally, that means that, of course, we do have to regulate drugs and drug use to promote public health. We can't just say, do what you like, Philip Morris, produce all the cocaine you can sell. We have to solve, and this is a big, big challenge to us, we have to solve the problem of the power of big business and commerce in America so that we can make it harder to buy drugs, make it more difficult and to buy stronger and easier to buy weaker formulations. That's what regulation of legal drugs means. But it also means that we give up on abstinence or zero tolerance or any of these other artificial concepts that are just not right for everybody. Now, I just want to say a few, looking to evidence, because ultimately that's what I want to look at the experiences of 5 European cities that had drug scenes that were very much like, say, we have now in Philadelphia and the Kensington area in the last 3 decades of the last century. And they basically drove those problems away using primarily supportive interventions. Now, they had some things that seem increasingly hard to have in American cities, but should not be impossible. They did have good systems of action, good government coordination systems, good information systems, and they had a shared political and social consensus that we should use supportive, human rights respecting measures to deal with drug use. Those are all attainable in American cities right now. We may not be able to get the whole country to agree on drug policy, but we can get our cities to agree on drug policy, and to a considerable extent, our cities are where the problem is. So we have hope there. And all 5 of these cities got pretty good consensus around a supportive approach. They also went right to the most obvious harm reduction and treatment measures. Very low threshold opioid maintenance treatment. Forget signing up at a clinic, and maintaining clean urines. Let's just talk about getting people in where they are and helping them come back when they relapse. Providing needles. Every place was doing that. We don't do that still everywhere in the United States. We still don't have safe injection sites. We don't have heroin-assisted treatment, which has proven to be really useful for people who are really long-term heroin users who just won't work on methadone. Of course, providing housing. 4 out of 5 places we're building housing and putting people into it because housing is so important to stability and starting over in life if you've had a serious substance use disorder. Providing shelter otherwise. Providing places where people can just hang out and get contact with services. Sending social workers out onto the street. And mixing policing and social work services. These supportive elements worked. Now, there were some coercive elements. I don't want to be, soft pedal this. They were much less important and much less systematic. Zurich was locking some people up if they weren't behaving. In fact, every city tried to break up public drug use for the sake of the neighbors and to establish a norm of better behavior in the drug scene, to break up the scenes to some degree. 4 out of the 5 used some kind of mechanism to require people to behave, not necessarily to get treatment, but to conform their behavior to social norms. Treatment within the criminal justice system was a minority element, and it should be, because it's not that effective. But interestingly, the criminalization or decriminalization of drug use was not that important. If you had the supportive, life-affirming, people-first interventions to help people, how you dealt with them at the law was less important because we started to get the police out of the picture. So I'll leave it at that and just say that we have a lot of resources available to people who are interested in both doing research and understanding what drug policy is across the country, including emerging strategies such as in Oregon, which is modeling more the decrim model. And we're happy to help people who are interested either in doing research or in otherwise tracking what's going on in the law. We have a big staff that's there pretty much on demand with an email. We're happy to be of assistance. So my big takeaways here are that law shapes the social determinants that impact health, and we should never forget that. We should always include real change in the terrible inequality we have in this country and the structural racism as part of the basic agenda for now, because doing that now will make things better in 5 years. Whatever we do now, if we don't do that, 5 years from now we'll be in the same position. Criminalization just doesn't work. Supportive policies do. You pick. And now I'll turn it back.
Great, thank you. It was very, very informative, and I love the circling back to the social determinants of health. So I am pleased to introduce to you all Antoine Quarles, who was born in Baltimore and raised in Park Heights neighborhood in Baltimore City. He was adopted shortly after birth and felt the absence of the parents, especially his father, throughout his young life. In 2014, Antoine founded Hope Baltimore, helping oppressed people excel. Led by those with experience overcoming the challenges of returning to society after incarceration, Hope empowers men and women to make this transition successfully and permanently. Tuan.
Welcome, everybody. Thank you. Scott Barris, like you touched on a lot of good points about decriminalization and policies, and Ms. Amanda, like absolutely. But one of the things that Hope really focuses on is about empowering, educating people about the barriers, because like for a long time, I grew up in a standpoint of everyone that I've seen around in my neighborhood, you know, there was some working families, but there was close knit. Most of the individuals that I was with to follow, like used drugs, sold drugs, carried guns, went to prison. And that was a family life that I came up in trying to masquerade to like prove myself of who I was. And then when rec centers and things of that nature was closed down, the lack of interest of like really learning in school, and no one around me was like talking about going to college. Most of my friends like was being shot, we was using, selling drugs, and they was going to prison, you know. And that episode happened with me. I started using at the age of like 12 or 13 heroin, and went on all the way to the age of 40, 43, you know, while in the same process, spending over 2 decades in prison, leaving a child out here with a mother with no real measure of understanding how to be a parent or understand their struggles or what they was facing and going through. And then in 2014, I was released, and then the supportive service that I was paroled into gave me a change model, and then was shut down by the government because it said that the tax dollars that it was saving on high-risk offenders to stay home was impediment against the ruling of what they was trying to do. So that's when I started learning more about drug policy laws and the over-sentencing tactics that dealt with zero tolerance and things of poverty and individuals coming home but being released back to zip code zoning areas where rearresting was happening with no supportive measures or no supportive services. So with Hope Baltimore, I focused around educating individuals about the barriers of what makes them continue to like leave prison after decades and then come back and try to take your place back in the community when the community has changed. Why not have an idea how to structuralize back into your family life, but then they have been redlined and moved away and told if you come back home and you connected to them that they'll take their housing. So this causes a separation inside the family measure. You know, looking at now for the first time being an employee for Emmanuel Episcopal Church, and also being able to like coach and mentor over hundreds of guys that now like 80% of them have their own jobs, you know, they have housing. We have like a 92% rearrest rate, you know, where none of us has been incarcerated again, but yet we're working on voters registration to educate people on how to vote and why they had to need a voice to vote. Community support of doing back to school events for youth to provide book bags and resources for the fathers and mothers who need housing, who need job placement, who need expungements. We're networking with delegates and lawyers to like come into these communities and talk about what is the process to build a village, but what type of resources need to be in the community so the community can thrive. And then the youngins or the youth of that generation that's growing up don't have to walk through a neighborhood to get to school to get sold drugs or learn how to sell drugs, but can leave the school and go to a resourceful place where they can learn a trade and skill and how to better and build and strengthen their community. Over the past 3 years, we have been focusing and talking about for each individual, like Mr. Burris talked about, and Ms. Amanda talked about, where over 2.3 million people are convicted by some stigma or conviction level, where 39,000 a year, in Baltimore and Maryland alone, where over 7,000 people return back to Baltimore City with no real regional idea, where they have a stigma that says out of 71% of those who return after 3 years, only 4% will remain out. So we have been really trying to like change that and looking at that mechanism to like work with individuals, females, and all of that are coming home, because we have found policies now have targeted men, but in the last 7 years, they have been targeting women. And when medical and pharmaceutical drugs are coming up to be the elusive way to deal with trauma and pain, and we look at most of the communities in the city are traumatized, and everywhere that you look around between West and East, that everywhere has become a pothole for medical assistance of the drugs to be sold, then youngins are following a nature of what their ends will look like in the next 10 years. So we're just trying to put a pathway that shows that hope brings a belief, and where hope changes lives, we have to empower the community how to raise a village so these youth can have a various understanding of where their life is going and what their future will also look like. Also that like the drug war epidemic, if we look back to parole policies that started in 1922, but now in order to get pardons, a governor has to pick a certain amount of people and let them go. But if you go back to 1837, where the first person got arrested and got a pardon, it was basically because they did well in prison and got resources, and someone was able to guide them once they got out after serving 13 months of their time. But we look up at the 1957, a parole commission was created to therefore leave the pardons in the governor's hand and then make a decision on how many people could actually be pardoned. So now we have parole stipulations that have been put to make a decision on whether or not what you do will redline you to return back to prison instead of helping you streamline you so you can be successful in your society. And with that, I hope I cleared a lot up for people to understand what hope really tries to do in Baltimore. Thank you.
Thank you so much, Tuan. I think some of what you mentioned really resonated with me, that, talking about some of the root causes of communities. This isn't a crime thing, it's or a Black thing. It's a root causes of historic discrimination, and I really appreciate the perspective that you brought to the conversation. So I'm going to share my screen again and just review. Here's some of the takeaways: that communities have been targeted and burdened by incarceration and paid a price in dollars and in lives. Redlining and trauma plays a role in crime and other outcomes, and living free leads to hope, and hope changes lives. So now I'd like to introduce to you Alejandro Zaragoza, who serves as a grant specialist and program lead for community and local equity grants unit at the California Governor's Office of Business and Economic Development. As part of his role, he has the opportunity to witness the development and implementation of the Community Reinvestment Grants program from its inception. Prior to working at GoBiz, he worked both in the social and private sectors, including work for international development projects in Ghana and Paraguay, as well as doing product management for a tech startup. And he was born and raised in Mexico. Alejandro.
Thank you, Amanda. Could you give me a thumbs up if you can see my screen, just to make sure that.
Thumbs up.
All right. Thank you for having us. As I actually appreciate the way that this webinar has been laid out, because it illustrates an important point, and it is that in order for us to remedy some of the harms that have been caused by the war on drugs, this is going to have to be a collective effort. So this is going to be an effort involving communities. This is going to be an effort involving researchers, policymakers, and nonprofits. Maybe we can have some social impact enterprises as well as there, but also government. So I would like to speak from a government perspective. But at the end of the day, this requires changes in policies. This requires deliberate efforts to serve these communities that have been disproportionately impacted. And I think at the citizen level, at the individual level, it requires a shift, a paradigm shift, so we can understand the struggles that some communities that have been disenfranchised have faced, and what's our part in it and what can we do. So I'm gonna start, hopefully shows, there you go. All right, so I am representing the Community Reinvestment Grants Program today. This program was created through Proposition 64, which was a voter approved law. Basically, this law was put on the ballots, and Californians decided that this is something that they wanted to pass. It's good to know that the Community Reinvestment Grants Program is just a small part of Proposition 64, which, as most of you already know, legalized the adult use of marijuana, among other things. It created some programs, but the purpose, the intent of the law behind Proposition 64 is to acknowledge, number one, and number two, do something about all the inequities affecting certain demographics. Specifically to CalCRG, this program was created with the intention of providing funding for two types of organization, that is nonprofits, community-based nonprofits, and also local health departments, though the vast majority of our grantees are community-based nonprofits. Statute also stipulated that we must be service delivery focused. And these right here at the bottom are the 6 funding categories that an applicant may submit a proposal for. So if an applicant is providing services in one or multiple of these categories, which I'm going to read, are job placement, mental health treatment, substance use disorder treatment, legal services to address barriers to reentry, linkages to medical care, and system navigation services. Any combination of those, in addition to some of the requirements, the other requirements that we may have, they may apply to our program. So something also interesting to note is that we were given 3 sentences of statute, and the rest was go figure it out, which was a very interesting exercise. But I also appreciated that the law was not too prescriptive, and that it gave us some latitude, because it allowed us to engage community members, engage community leaders, and understand what is it that they need, what is it that they would like to see in this program. And then from the beginning, the 4 founding members of this program, we talked about it, how we wanted this program to be different, and we wanted it to be something that is informed by feedback from communities, rather than having a top-down approach of hey, we're government, we're going to just hire experts and we're going to tell you what you need, right? So from these stakeholder engagement meetings, we did multiple ones throughout the state of California. That's one of the biggest things, right? These nonprofits were saying, we want, in these communities, we want to be led by people that live in these communities. Oftentimes, you may have board members or executive directors that they have no idea their struggles, or they don't have firsthand experience with the things that they're trying to solve. It's also good to live in the community because you get that context and history about those communities and being able to serve them better. We wanted it to be grassroots in nature. And we're less concerned about the size of the organization and more of whether or not they behave in a grassroots manner, meaning that they involve the community, they have a say, they inform service delivery, they perhaps are part of staff, maybe have leadership positions, and there are perhaps some seats available in the board of directors for these communities. Something also that became very apparent as we are engaging stakeholders is we didn't want this to become a writing contest, right? We know that organizations are in size and capacity, and that means that some organizations will have money to hire a grant writer, and we didn't want to affect smaller organizations that may not have this ability. So we were intentional in how we design our grant solicitation, and to this day, like we keep making changes, and we will continue to make changes as we get more feedback. But that's one important thing we kept hearing for these communities. The other one is we realized the importance of jobs for all the barriers and challenges that people that have been disproportionately impacted by the war on drugs face. The ability to have a job affects your mental health, affects your ability to access health services, ability to access healthcare. So we wanted to make job placement a priority. All right, as we have gone through multiple rounds of funding, we realized, hey, we want to balance the number of grantees that we have versus continuity. Meaning the more grantees we have, the less funding we can provide, and potentially, there may be a break in the continuity of services to these people. And we know that some of these services, like mental health treatment, for example, this is not you go and do a few sessions and then your mental health is perfect. This requires services throughout an extended period of time. Also, we face a challenge of how do we objectively measure how communities were affected by the war on drugs, because statute was very specific about this word disproportionate, which was key, meaning many communities have been affected by the war on drugs in California, and perhaps one can make a case that every community has been affected by the war on drugs in one way or the other. But we wanted these dollars to go to those that have been most impacted. So how do we measure that in a way that is objective, but that also allows communities to provide context, added context, that there's no way we could have all the context and history from all the communities that we're trying to fund. And lastly, small CBOs versus large CBOs, which a little bit I touched a bit on before. How do we make it that they can both submit applications, but small CBOs or community-based nonprofits are not affected? And our solution was to create same grant solicitation, just have two different buckets of funds, so small CBOs can apply and compete against other small CBOs. Right. So to date, we have seen impact from the projects that we fund. And the very last slide, actually one of the last slides, I will show some of the statistics that we have to date. But I would like to highlight some of our grantees so you can get an idea of what types of projects we fund. And what we fund varies. Some of them are evidence-based services that have been researched, and there's evidence that they have a positive impact. And some of them are innovative approaches. Like, for example, this one in Oakland, they wanted to provide individuals coming back from prison an opportunity to find housing, and that's something. It's a high source of stress for individuals coming home, and they face many barriers. So they, instead of building new facilities, they decided, why don't we try an Airbnb approach? Why don't we ask members of the communities that would like to host individuals coming home from prison, and we give them a stipend. And so far, this model, very innovative, has been working well for them. So that's an example of the types of projects that we provide that is more on the innovative side. We have another one here, Community Against Sexual Harm. They're based in Sacramento, and they do great work serving women of color, not necessarily specific of color, but women that have been disproportionately impacted by the war on drugs, but the vast majority are Latinx and African American. And these are individuals that the majority of them have experienced commercial sexual exploitation. So what CASH does is provide them with mental health treatment, substance use disorder, and help them reduce their substance use, or in some instances achieve sobriety. But the intention is to help these individuals that have experienced so much trauma and given the support that they need in order to have more stable lives, and eventually remove some of the barriers to employment and help them find jobs. In some instances as well, these individuals are provided legal assistance. As a short story, one of the leadership of this community was sharing how this individual came to them with a couple of little kids that didn't have a place to stay. She was very anxious. She had a substance use disorder problem, and I believe she also was on parole. So after a few months, they were able to find her a job quickly. They were able to find her a place to stay where her and her kids are safe. And she's happy to report that her records have been expunged. So right now, less barriers for her. And we know that there are many barriers that they face, and great work that these communities are doing serving these individuals. The last one that I'd like to highlight is Grid Alternatives and Homeboy Industries. They're a collaboration, and what they do is through case management and transitional employment, and they give stipends to their trainees, is they provide workforce development, which ultimately leads to job placement, but they also provide system navigation, which means, hey, let's look at all the services that you may need, and let's start connecting you so you access those services. And they're based LA, and they're doing great work. Here are some pictures of their training program. And the vast majority of their trainees that complete the program, they go and continue and obtain jobs and careers in the solar industry. And this is something that was shared with us that I would like to read a little bit before closing. Said, through this grant, Grid was able to serve 41 individuals over a 2-year period. If you think about the cost of incarceration, the cost of having somebody in prison, like 41 individuals may not seem like a lot, but the cost of having somebody in prison is very high. And as the other panelists have already mentioned, like, we don't do a lot of rehabilitation in California and the United States, right? It's based on punishment. So 41 individuals, it's a good number. 31, were able to complete the program, and 22 of those were able to secure a full-time job. This is for Grid. Homeboy Industries, they were able to provide wraparound services to 160 individuals. And they continue, right? They're providing these services to justice involves individuals who have been disproportionately impacted by the war on drugs. So these 3 grantees are an example of the type of work that we fund. Not all of our grantees provide job placement, but because it's one of our priorities, I wanted to highlight these. And just to finish, here's some of the impact that our program has had when it comes to the different funding categories. The people that we've been able to serve so far, around 76,000. But the hope is that this will trickle down and it will expand beyond the individual. It will touch families, and then eventually, it'll become more of a movement, and more governments will acknowledge the harms that were done by the war on drugs, and the funding will keep coming. And lastly, as Governor Gavin Newsom of California mentioned, it is our responsibility, right? I was born in Mexico, and I owe everything I have to the work of two great women in my life, my mother and my grandmother. And even then, despite their hardships, I consider myself to have been born in privilege. We were not rich by any means, but I understand how a zip code can mean so much. It can mean opportunity, or it can mean the lack of opportunity. So it is all of our responsibility to do what we can. That concludes the presentation.
Great, thank you. I love how all of the presenters, one unifying theme of everyone's contribution to this webinar is sort of the underlying social determinants and how important those things are. And often we direct our attention to the most visible thing, which is the use of drugs or crime. I'm familiar with Homeboy Industries, and one of their slogans is "Nothing stops a bullet like a job." If you think about that, that is a great mantra for most of the social ills that we see, whether it's drug use or crime. So I'm going to, and thank you so much, Alejandro, for sharing that great work. I would like to invite the panelists at this time to come back on screen. We just have a few minutes left, but we do have a couple of questions. There is one that was directed towards you, Antoine, but I think we can pitch it to everyone. So the question is to Antoine, what are you sharing? What you are sharing is such a tremendous issue across our nation, specifically within the underserved populations in urban areas. Aside from educating and informing returning citizens on drug policies, et cetera, does HOPE also provide supportive services in economic mobility and advancement? Economic advancement is so critical to provide communities the ability to advance themselves and break the multitude of barriers that they face. And so that question is to you, Antoine, and to others on the panel about the importance of employment and economic security in addressing the criminal legal effects on addiction.
Yeah, basically we try to though we do a peer coach model, but we do have network partners that does the job placement and services, but we go to communities to do events, like legal aid and expungements and stuff like that. But one of the things that I was talking with one of my funders the other day from Baltimore Core and Kennedy Krieger about how is it that we can utilize a mobility van to create jobs and time shifts for people to go to communities and see and be able to see faces that they know that have been a change and that can bring these resources back. Talking with Yale, Birmingham, and some things, other cities that are also high risk on how to build hope in those cities and make them a different chapter. So these barriers and evidence of change for employment and housing, and learn these things, how to build community, because it takes a village to build a community, but it takes a community to raise a village, to house a village, and to build a child and build families.
Thank you. Alejandro, Scott, anything you want to add?
Well, what's so inspiring about somebody like Antoine to me is that he's just out there doing social determinants every day. It's very easy to think of social determinants as out there somewhere. If we just, somehow, I mean, it's beyond the realm of work, but 90% of social, well, I wouldn't say 90, but a big chunk of social determinants work is just helping people cope and find a way through the maze that the society has set them, so that their natural resilience and their strength and their assets can come out. But I also, I guess gotta say, we sent $40 billion to Ukraine at the drop of a hat. We spent trillions of dollars blowing up Iraq and Afghanistan. Those dollars could have been invested in our people here. And this is not generational change, really. I mean, I'm 65 years old. So when I was born, we had the smallest level of inequality, income inequality in our country. And we had a progressive tax rate of somewhere in the range of 90%, marginal tax rate, around 95% for people like Jeff Bezos. And still we had a booming economy and we had prosperity. By deliberate action to undermine labor and labor rights, to disinvest in public education, and to lower tax rates and reward financiers, essentially, we've created in 65 years the highest inequality in our history. This just has to be undone. It can be undone, but we can't lose the ball. So we gotta help people right there on the street because they need it now. But we have to feel the urgency of turning around this ship of inequality that we have been deliberately heading in the wrong direction, since the Reagan era.
Thank you. And thank you for the reminder of how, yes, we do need to help people who are in need right now, but there is also a need to address the underlying issues that have caused trauma, that have taken resources out of communities. I think we should get to the point at some point we should recognize that folks should not have to be so exceptional to overcome all the challenges and navigate such disparity. And that will truly be addressing the root causes, and we should pursue that end. So thank you, everyone, for joining us. I thank very much the panelists. Each of you brought such an important perspective to the conversation. I want to welcome the attendees to provide some feedback. We have a SurveyMonkey here, QR code if you want to take a picture of that and provide some feedback later. Thank you everyone, and we hope to see you at our next webinar. And you can find the registration for the next webinar at the bit.ly link SDOH webinar 2022, and those are all under lowercase. All right, thank you. Bye-bye.